All right, everybody, Dr. Rees here from Vet Triage. We are continuing on this issue of JAVMA, July 1st, 2015, and we're going to be talking about cats and evaluating shock status, a very common concern in an emergency hospital. The association of blood lactate concentrations with physical perfusion variables, blood pressure, and outcome for cats treated at an emergency service. The study comes out of University of Pennsylvania Vet School. The objective is to determine the association of blood lactate concentration with physically assessed perfusion variables, systolic arterial blood pressure, and outcome in cats evaluated by an emergency service. Prospective observational study, 111 cats. Results found median initial blood lactate concentrations was 2.7 millimoles per liter. Cats with white mucous membranes, abnormal peripheral pulse quality, hypothermia, had significantly higher lactate than did cats without these findings. Median lactate concentrations for cats with systolic arterial blood pressure of less than 90 millimeters of mercury was significantly higher than cats with blood pressures over 90 millimeters of mercury. Cats with severe shock had significantly higher lactate at 4.3 millimoles per liter than cats in other shock categories. Median initial lactate concentration at admission did not differ between cats that did and did not survive. Change in lactate during hospitalization was not associated with outcome. Conclusion was that findings indicate that blood lactate concentration, together with physical exam findings and blood pressure, may be a useful tool for identifying abnormalities in tissue oxygen delivery in cats. However, lactate concentrations were not associated with outcome in this study. Introduction. Shock is defined clinically as the presence of hypotension, oliguria, poor perfusion peripherally. In the early stages of shock, termed occult or compensated shock, many patients may have relatively normal vital signs of blood pressure. However, tissue oxygen delivery may be compromised. Conditions of poor tissue perfusion, where there is inadequate oxygen delivery, cells switch from aerobic to anaerobic metabolism for cellular energy production, leading to increased lactate. Lactate is metabolized back to pyruvate through the Cori cycle in the liver, and to a lesser extent by the kidneys. In conditions of circulatory dysfunction, prolonged high lactate may occur because the liver becomes a net producer of lactate and clearance of lactate is impaired. There are other conditions associated with high lactate like liver failure, cancer, seizures, and sepsis. In people, circulating lactate has been extensively studied and is considered to be a better predictor of shock compared with traditional vital signs alone. Blood lactate concentration reference values in dogs and cats that are normal is less than 2.5 millimoles per liter. Although a recent study in cats that were healthy suggests that lactate concentration up to 2.8 millimoles per liter may be present, investigators found that lactate concentration was not affected by struggling, venipuncture site, age, sex, or time of admission to the hospital. Studies in dogs have shown that high lactate at admission or persistent high lactate have worse outcomes. Than those with lower lactate concentrations or where lactate becomes normalized. So those of you who have watched this channel have seen the GDV talk that I gave, and this is what they're quoting here probably. Anyway, well, it's a common phenomenon of GDV dogs, and so that's one of the things that we have in those lectures. So feel free to watch those videos on GDV. It has been suggested that clinical signs of mild systemic hypoperfusion lead to minor increases in blood lactate, like 3 to 5 millimoles per liter, but signs of severe systemic hypoperfusion have values over 7 millimoles per liter. In a recent study evaluating the use of a shock index, where shock index equals heart rate divided by systolic arterial pressure, dogs with hemorrhage were assigned shock categories, level 1 with no shock, all the way to level 4, which is severe. In that study, dogs in shock had lower body temperature, lower pressures, a higher heart rate, and higher lactate compared with healthy dogs. Materials and methods. Bradycardia and tachycardia were defined as heart rates of less than 160 and over 225 beats per minute, respectively. Hypothermia and hyper, rectal temperature 37.8 degrees Celsius or 100 Fahrenheit, or over 39.4 degrees Celsius or 103 Fahrenheit, respectively. The systolic arterial pressure measured by Doppler flow detector with a 9.5 megahertz probe following standard technique. Lactate concentration of less than 2.5 millimoles per liter was considered normal. Results. Median age 9.5 years. Median weight 4.68 kilograms. Mostly domestic short hair. Most common renal disease, followed by GI disease, followed by endocrine disease, followed by cancer, and then a bunch of others. Median initial blood lactate 2.7 millimoles per liter. 45% had lactate less than 2.5 millimole per liter, and 61 cats had hyperlactatemia. Of the ones with high lactate, 66% were 2.5 to 5, 20% were from over 5 to 9.9, and 15% were over 10 millimoles per liter. Cats that were defined as having white mucous membranes, abnormal pulses, and low body temperature had a higher median lactate compared with alternate groups of each category. Neither low heart rate or high heart rate was significantly associated with increased lactate. Of the bradycardic cats, 77% were concurrently hypothermic, 14% normothermic, 3% hyperthermic. The median systolic arterial pressure was 92.5 millimeters of mercury. 42% had hypotension, 58% had blood pressures that were 90 millimeters of mercury or more. Median initial blood lactate for hypotensive cats was significantly higher than for cats with blood pressures over 90. 40% of cats with hypotension had a systolic arterial pressure of 30, assigned because no blood flow was detected via Doppler flow detector. Hypotensive cats, which are 35%, had lactate concentrations less than 2.5 millimoles per liter. Conversely, 46% of cats with a blood pressure of over 90 had a lactate of over 2.5. The median lactate concentration of cats with abnormal femoral or metatarsal pulses were significantly greater than cats with normal results for the same variable. Initial lactate concentration was significantly inversely correlated with systolic arterial pressure. The median initial blood lactate concentration of cats with severe shock at 4.3 millimoles per liter was significantly higher than cats with either mild to moderate shock or no shock. 54% survived, 46% euthanized. The median initial blood lactate concentration was not significantly different between cats that survived and those who were euthanized. Most of the non-survivors, 65%, were euthanized within 12 hours of initial evaluation. Compared with the initial admission value, lactate measured during hospitalization either did not change or was increased in 13% of cats and was decreased in the remaining 87%. Neither an increase nor decrease in lactate from the first measurement was associated with outcome. Similarly, among 27 cats that were initially hyperlactemic and underwent repeated lactate concentration measurements, there was no significant difference in median lactate for cats that survived versus those that were euthanized. Discussion. In this study, cats with abnormal findings for peripheral perfusion variables, white mucous membranes, abnormal peripheral pulses, low body temperature, and low blood pressure had significantly increased pre-treatment lactate, indicating altered tissue oxygen delivery compared with cats that did not have those abnormalities. Low heart rate, which is a common finding in critically ill cats, was not associated with increased lactate concentration. The median initial blood lactate of cats with severe shock at 4.3 millimoles per liter was significantly higher than cats in other categories, which is 2.3 millimoles per liter or less. However, some definitions of shock also include an evaluation of metabolic markers of abnormal tissue oxygen delivery, such as high lactate, metabolic acidosis, decreased base access, tissue oxygen saturation, and central venous oxygen saturation. Two other studies in which investigators evaluated whether struggling during phlebotomy affects lactate in cats had conflicting results. One study found that there was a significant increase in lactate at a mean of 3.56 millimole per liter compared with baseline at 0.33 millimole per liter, but another study found that healthy cats not struggling during venipuncture affected the blood lactate concentration. In the present study, the median initial blood lactate in cats that were euthanized, 3.2 millimole per liter, was not significantly different from cats that survived at 2.45 millimole per liter. Although, those differences, the ones that were euthanized, even though it wasn't significant, 3.2 is above normal range, whereas 2.45 is right there at the cutoff. So, there may be some substance there. In addition, for cats that had the measurement repeated during hospitalization, there was no association between increase or decrease in lactate and outcome. These findings are in contrast with dogs, in which a high lactate at hospital admission and persistent high lactate is associated with increased morbidity and mortality. A hyperlactemic patient, if there are no other clinical evidence of hypoperfusion, then other reasons for lactate elevation should be investigated. So yeah, overall a good study. We always want more animals, but 111 cats is really good. We need more standardization, of course, but very, very useful. And a lot of this is not surprising. So for veterinarians, keep in mind that cats can show up with shock differently than dogs. The main difference really is the body temperature, the blood pressure. They will have blood pressures that are normal and be in shock. And also with heart rate, they will have low heart rate if they're in shock. Whereas dogs, you typically expect blood pressures to go down, heart rate to go up. So don't forget there are differences between dog and cats in shock. Cats can fool you when they're in shock. They can look surprisingly good on physical exam, but actually be in trouble. And one thing that I wasn't a fan of is palpation of femoral pulses or metatarsal pulses. It's hard in dogs to even be consistent across the board with that. It's very subjective, and cats are especially difficult because of how tiny they are. And if you're trying to determine pulse quality in a state of shock, I find it hard to believe that they can reliably, palpate it. But that's why you need standardization. Maybe if you had one veterinarian in charge of these cases and more animals, then you can get a more accurate baseline. All right, thanks again for supporting the channel. We'll see you guys again tomorrow. Bye-bye.